Well, hello everybody, and welcome to the Destination Ulster Podiatry course talk. My name is Raymond Robinson, and I'm the current course director for podiatry, the undergraduate podiatry degree at Ulster. And I'm very aware that a lot of you are uh, leaving school and applying for courses, and some of you might be considering podiatry as a career. And I'm just going to talk you through our course and what it's about, and give you a little bit of a feel for it. And hopefully that will help you to make up your mind to do podiatry in the future and make that one of your choices. So I suppose the first thing I really have to say is that for a number of years now, we've been the podiatry degree has been based in the Jordanstown campus, and as you probably already know, all of health sciences, all of the courses are moving to the McGee campus in Derry, Londonderry, and that will be happening from this September 2022. And that's where the course will be. So whenever you come onto the course, you'd be all of your lectures and practicals would be in the McGee campus. However, that would maybe be involving a little bit of travel for you, but nevertheless, the McGee campus is a very new campus. We're going to have some very excellent facilities there, very updated facilities. So everything will be looking very, very new, and it should be a fantastic campus to work from. I don't know if any of you have ever been to Derry or Londonderry. My first post in the NHS as a podiatrist was actually there in the Western Trust, and I worked there for 5 years and lived there, and so I can attest to the second part of this slide, a vibrant nightlife. It definitely has that, and there's quite a lot going on actually up there. A lot of city festivals. There's a lot of cultural venues up there, and of course you're very close to the Republic of Ireland and the border, and a lot of cross-community work gets done there too. So fantastic location. It's also very reasonable as a place to live. I bought a house there, and definitely cheaper than Belfast and most other cities in Ireland. So from the point of view of living expenses, you'll not need as many whenever you're living up there. So it's definitely a good value. So what am I going to cover today? I'm going to talk a little bit about studying podiatry at Ulster, a little bit about the course and what you're going to learn, the kind of methods that we use to teach you, and the support services that we have in place. And I've also got some information from a couple of students, one second-year student and one third-year student, giving us their opinions on the course, so you can see that. And then I'll talk a little bit about future careers towards the end. So hopefully at the end of all of this, you'll have a pretty good feel for what podiatry is, not just as a course at Ulster, but what the profession is like in Northern Ireland and abroad. Okay, so why would you want to study podiatry at Ulster? Well, there's a couple of good reasons. As I've said, we're moving to the McGee campus, and we're having a fully and newly furnished clinical facility being built for us. So everything will be brand new. We're going to have a live patient clinic, as we had in Jordanstown. We're going to have one up in McGee as well, a bit bigger than we've had before. And it's a specialised teaching clinic, so we'll have patients coming in from the trust, and members of the public will be coming in to get their feet treated and their legs and problems with their legs sorted out, and you'll be involved in under supervision in treating those individuals. So very, very practical, very hands-on kind of course. So very personalised teaching support. We're not the biggest course in the world. I mean, physiotherapy has something like 80 or 90 students going into it each year. We have about 20, so much smaller numbers, and that enables us to really get to know you quite well over the 3 years that you're here, and give you a lot more teaching support as well. We also have As part of all the courses, all the health sciences courses, and we also have some sponsored prizes as well, and internships. So, for example, we would have the College of Podiatry, which is our branch of our professional body, gives us awards each year for uh, good academic achievement for students in year 1, year 2, and year 3. Financial awards for that, and also we have some sort of connected internships abroad. I've been just recently, trying to set up some placement opportunities in Singapore. So not only would you have the opportunity of doing your placements in trusts in Northern Ireland, but you may well get the chance, if you're interested, in going out for a few weeks to Singapore to get some placement experience out there. So great opportunity to do a bit of traveling if you're interested in that. So what are you going to actually learn whenever you're here? Well, there's obviously some basic skills that you need to have in any health profession, and we're very much focused on anatomy of the lower limb, musculoskeletal pathology in particular. You'll learn a lot about that. You'll also learn about pharmacology and the drugs that we can use, because we use local anesthesia, and we use steroid to inject into people for pain conditions. And actually, we're I think we're still one of the only courses in the UK that teaches you how to use steroid as part of your treatment plans with patients. We're one of the only undergraduate courses that do that. And we were the first to do it. So we're leading the way in that regard. You'll also learn about vascular problems that people will have, particularly diabetic patients, and wound care and how to manage wounds that occur on the lower limb and the foot. And even you'll also learn a wee bit about surgery, because we do some minor soft tissue surgical procedures in our clinics, and you'll be involved and trained in how to do those as part of your undergraduate course. And you can also then, if you're really keen on surgery as a potential future career, you can use the podiatry undergraduate degree as a stepping stone for going on and doing podiatric surgery, which is, bone and tissue surgery up to the ankle joint, which is further training, but this would be a stepping stone for that. So it doesn't just all end with the undergraduate degree. So the degree is designed to give you all the skills and the experience you're going to need to get yourself started in a career as a podiatrist. And our degrees are 3 years, full-time 3 years, and we have placement where you're placed out in the NHS and in some private practices as well throughout the course, so that you get to experience real live, clinical activities. And we also have our own, of course, as I've mentioned already, in-house clinical facility where we do the majority of your teaching, which I think is excellent and a fundamentally important part of the course. So whenever you actually start the course, you'll be coming into your first year, and you'll be learning about anatomy, because obviously you need to know where everything is on the limb before you can start to examine and diagnose the problems. We'll be doing a musculoskeletal work to start all of that off, and then we'll be doing another module called patient assessment, which looks at the vascular and the neurological anatomy and pathology of the lower limb. So you'll do that in your first year, and then when you move into second year, it gets a little bit more in depth. We were doing stuff like medicine and pathology, where it'll become a bit more about body systems and how that interacts with the lower limb, more in depth on musculoskeletal work. You'll be introduced to pharmacology, various drugs that are available, not only drugs that doctors use, but drugs that we use as well, and because we have access and supply to a range of medicines such as antibiotics, for example, and local anaesthetic that you will get access to whenever you're qualified. We'll also have a course on local anaesthesia and steroid injection, so we'll be talking you through all of that as well. And then whenever you move into your final year, you'll be getting into a bit more in-depth material. So high-risk foot, for example, that would be patients who've got diabetes and rheumatoid arthritis and gout and a range of sort of systemic pathologies that can affect the foot. You'll do more in-depth work on that, learning about how to manage wound care, how to offload the foot, antibiotic management and things like that. And we also have a module on surgery and imaging, how to read an X-ray, order scans, and what kind of surgical procedures can you recommend for a patient if you're referring them on, to get surgery of the foot, either to an orthopedic surgeon or a podiatric surgeon. We have a module on prescribing because, as I've said, you've got access, you can access and supply a range of drugs. So that means that if a patient presents to you with a foot infection, for example, you can assess them and supply them with the antibiotics directly without having to send them to the GP for a prescription. And then you've also got a research project to do, which all of the allied health courses have you doing. You'll have a research project which will run throughout the final year for you to do as well. So plenty of interesting things to be covering. And how are you going to be taught? Well, as I said, this is a full-time course. So in effect, normally your classes would consist of clinical classes, practical classes, and lectures and tutorials. And approximately, you'd probably be on campus, doing that kind of work for maybe 15 to 20 hours per week. And then you'd be expected then to be doing some personal study yourself of about 12 hours per week. Okay, so that you're keeping up with the work and reading around the subject areas that we teach you. You do have support for all of this, and we have a very, very good online learning tool called Blackboard Learn, where the lecturers can put up information for you, can put up the lectures for you, and we can run live lectures online using this tool, and we can put in a lot of other resources as well for you, videos and things like that, which are to help you to learn about this subject. Some of the work that you will do on your own as an individual, and some of it you'll do as part of a group. You'll do some project work together in some of your modules, and some of the work you'll be just doing individually. So it's a bit of a mix when it comes to your learning on the podiatry course. In terms of assessment, well, we assess you using exams, which I'm sure you're familiar with, coursework, where you do a piece of work and then you hand it in and we mark it, and also these things called OSCEs, which is objective structured clinical examinations. So basically what that is we would assess you on your practical skills, maybe with a patient present or with another student present as part of your overall assessment. So we call this a blended learning approach. Basically, we teach you in lots of different ways and we assess you in lots of different ways so that overall we get a good all-round understanding of how good your knowledge is at the end of the course. And from that information, we're able to award you marks and your degree. Now, you will get a lot of support. I'm very aware that whenever you come from school, that you're coming to university, it's all very different, and you're required to be, you'll discover whenever you come to university, you're required to be more of an independent learner. So we sort of teach you things and we tell you, go and read this and go and look at that. But then you're required to go off and do some of that work on your own or as a group. And you're not going to be supervised heavily all the time. So that's quite different from school, where you're maybe given much more close supervision and that kind of thing. So so it is a bit of a change, but one which we hope you will get used to and develop into as you go through the course. Now we do have help with all of this. You're not just left to your own devices. We do have, because we're such a small course, we have a lot of one-to-one mentoring. So you'll be given a studies advisor. Basically, a member of staff will have about 6 or 7 students in each year group that they will be the studies advisor for. And if you've got any issue with anything in particular, but and specifically with your studies, having difficulty learning something or not understanding something, then you would go to your studies advisor as your first point of contact, and they'll help you. You'll also have a supervisor for your research project who will guide you, and this is for your 3rd year research project, and they'll help to guide you through the process and make sure you stay on the right path and on the right lines. And also we have a student buddy system, so we will often link you up with, if you're a 1st year student, we'll usually link you up with a 2nd year or maybe a 3rd year student as a contact that you can have if you have any queries that you don't want to go through the staff about. You can do that through the student. We have a lot of online resources available through the Blackboard Learn system. That's the learning application that we have at the university, which is very useful. But massive amount of library resources. So you can access the library in person, or you can go online. The online library system is fantastic, and you can read journal articles and search for things and read books and all sorts of things online if you want to, or go in person to the library. Fantastic resource. And there's also, we have a lot of library assistants who will help you if you're not sure about a particular subject, or if you want to find a particular piece of information, you can go to them and they'll direct you to help you to find it. We've also had the benefit of having small class sizes, as I've said before, and that allows us to be a bit more intimate with you. We get to know you a lot better, and we tend to be more on one-to-one names with you by the end of the course, certainly, which is a good thing in that it means you've got more access to your lecturers and me as your course director than you might on other courses which have much bigger numbers. We also have career sessions built into the degree. So throughout the degree, I'll be sending out emails and saying, oh, I've got a talk for you by such and such a person from careers, and they'll be providing that talk usually online, and you can access that and engage with that, and that'll give you some very good information about study tips and about your future career and career directions that you can take. So it's always very useful. And there's also a wide range of student support services in the university. So the university has invested quite heavily in student support outside of the courses. So that might be for help with financial issues that you might be having, or it could be for help with personal problems that you might be having. And there are units and individuals in those units who are especially trained to help deal with and help you with those particular problems if you have them. And we can direct you as staff, we can direct you to those services as well. So it's fairly well set up in terms of support. Now, we've all just been through COVID-19, and you will have during your final school years. We were impacted, with universities all over the UK were impacted by COVID-19, just as you would have been at school as well. We had to reduce our on-campus clinical teaching. We still had it going, but we had to reduce it a bit and take some safety precautions and guidance from the Department of Health and how we delivered our material. Some of our work had to go more online, so we did more live and recorded lectures online, that rather than have people all jammed into a classroom. Though we were able to maintain, for the most part, your placements out in the trusts, so that was reduced a little bit, but we were still able to maintain that throughout the course to allow students to complete all of their placements and qualify. Now, at the minute, COVID-19, we're sort of edging out of that now, and we're getting back more to live teaching and more interaction. Certainly from a clinical perspective, we're pretty much back up and running. Your placements will be going ahead out in the trusts, and your live clinics in the university will be going ahead. There may be a little bit still of some online teaching happening, but I would say the majority of your lectures as well now will be going back to being live again by September. So you might find there's still a little bit of online going on here and there, but often that'll be more to accommodate staff and students, because we don't want to bring you up to the campus for half a day to do live work and then have the rest of it online. We're trying to organize it in such a way that if you're coming up to the campus, you'll be getting live experiences all day rather than half and half. So that process is still being worked out, but we'll get there. We also request students to be vaccinated against COVID-19. It's not compulsory, but it's definitely a recommendation. And as part of this course anyway, all of the health courses, you'll be having to undergo vaccinations for hepatitis and a range of different things, so that you can go out into the trusts. So we do recommend you get a COVID vaccine as well. So just briefly, I'm just going to introduce Shelley Anderson. Now, Shelley's not here, unfortunately, but she did put this slide together for me, and she was just, you can have a little read at this yourself. She was really just, we asked a few questions, why did you decide to apply for podiatry? What route did you take to get onto the course? And, what do you enjoy about the course, and that kind of thing. And that's all of her answers there. And one of the things that Shelley actually says that she really enjoys the practical aspect of the course, because really we're a very practically orientated, hands-on type of course. So if you like using your hands, if you like making things, if you like being physical and not just sitting in front of a book all day, then definitely this is the course for you. Right from the very beginning of the course, you're in learning, doing practical work on each other. And it's really good because it gets you right in there to what podiatry is really all about from the very beginning. So it's a good experience, and you do that from day one. So it's pretty busy from day one whenever you start the course. And this is Olivia. She's one of our final year students, and she's got some answers to the same questions there. She's always found the course interesting, she says, and there's always something new to learn every day, and that's probably very true. I'm still learning new things about podiatry now, and I've been doing podiatry for over 20 years. We have a lot of these students would have come through now, Shelley and Olivia, during the COVID period when things were closed down a little bit, but they would have had a lot more experience of online teaching than they would have had before. But they've managed to get through it okay. We all managed to get through it okay. A lot of the lectures that we ran, we tried to run live with the students. So instead of them actually being in a classroom with you, you were running it live, like this presentation, with interaction from the students throughout. So by and large, that worked pretty well. Though it's not as good as being in front of someone, but nevertheless, it did the trick, and we got through it all together. So a little bit about placement now, because this is a big part of our course, as it is with all of the health professions. We require you to go on placement in the various trusts in Northern Ireland, and there are 5 of them, as you can see there on the right-hand side of the slide. And we also require you to go and seek out a few private practitioners and go on placement, do a few days here and there with a few private practitioners, so you get an insight into what it's like being in a private practice as opposed to being in the NHS, and you get to see how a business is run. So there's a lot of learning involved with that as well. Generally speaking, when it comes to our trust placements, they're usually a couple of days per week in the trust. So you'd probably spend maybe two or 3 days a week in the trust, not all the time now, not every semester, But whenever you are on placement, it would be a couple of days in the trust, and maybe for 6 or 8 weeks in a row, and then your other days would be in the university or online teaching. So we've got a sort of a mix and match approach to this, where you're going out to the trust for a couple of days and you're getting some practical skills out in the trust, and then you're getting your theory teaching backed up around the same time in the university. And we really do like placement because it really increases your clinical skill levels, and that's fundamentally important. And it enables you to achieve the number of clinical hours that you need in order to practice. As part of our course, we are required to make sure that you've achieved at least 1,000 hours of clinical hands-on practice by the end of the 3 years, and that's a requirement to get registered with our profession and to get registered with the Health Professions Council to practice. So that's why we need the clinical placement in there. So not just your placement with us in the university itself and in the university clinic itself, but also out in the trusts and in private practice as well. That builds up that 1,000 hours that you need by the end of the 3 years. And the other good thing, of course, when you think about it, about placements, is that you get to introduce yourself to your potential future employer. If you go out and you do a placement for a couple of weeks in a trust and they like you and you're really good at what you do, and they will remember you, and if you're ever going for an interview, they will want you to join them. So you're advertising yourself for a future job whenever you're on placement. So don't forget about that. It also helps to build your professional networks because you get to meet staff out in the trusts and managers and that kind of thing, which is good. You get known, and that's important. And by and large, our graduates are often employed within a matter of a couple of months from graduation. And in fact, I would go further and say that right now, and probably over the next 5 to 10 years, most of our graduates are going to be employed before they've graduated. They will have opportunities for work, be it in the NHS, private practice, or both, or abroad, and they will probably have jobs lined up before they've actually gone and received their certificate of graduation. So there's a high demand at the moment for podiatrists. Talk a bit more about that in a second. As part of the course, we have some, it's not just the podiatry staff that are here in the university that teach you. You will get taught by a range of different people. So for example, in your second year medicine and pathology module that I mentioned earlier, all of those lectures are delivered by consultants who are working out in the hospitals in the various specialist areas that they work in, and they'll be delivering that to you. So it's fantastic to get taught by consultant medical practitioners who are experts in the field, and they're there teaching you as a podiatrist. It makes that particular module, it makes it much better. And also in the year 3 surgery and diagnostic imaging module, we have a consultant podiatric surgeon who comes in and takes you for a couple of days. It's a bit more of an intense sort of, he comes over for like 2 days and talks to you about surgery. And but he's a consultant podiatric surgeon who actually qualified as a podiatrist from Ulster some years ago and went on to do podiatric surgery over in England, and he's now a consultant. So he comes back and teaches for us for our final years and talks about surgery and imaging, all sorts of very interesting things like that. So it's really good to have that sort of consultant input on a course. I think it just raises the bar of the education so much more. So that's something to look forward to. And yeah, I was just talking about the demand for podiatry graduates, and I suppose this is a generic slide here. What do employers want? They want you to be qualified and have some practical experience, be able to solve problems and have some creativity, work a computer, be able to work in teams or to be able to work alone, and to be able to communicate well. They're all, the standard things that an employer would want, and podiatry employers are no different from that. But our graduates are currently in very high demand for their skills. There are simply not enough podiatrists in the UK and in other countries in the world as well. The demand is exceeding the supply. So even though we're producing maybe 15 to 20 graduates every year in podiatry, we probably need about 25 to 30 graduates every year. So there's plenty of work out there. The world is your oyster, and you will undoubtedly have loads of opportunities. And really, it becomes a case of you picking the job that you want, rather than having to compete against lots of other people for a role. So that's a good thing. It's good for you if you're a student looking for a job, or a graduate looking for a job. And we have graduates who work in the NHS. You would start off in the NHS as a Band 5 podiatrist. Some of our graduates go straight into private practice, either for themselves or they work for somebody else in private practice. Some go into higher education, maybe go on and do a master's degree or a PhD. Others go into elite sport because they have a sporting interest, and some will work abroad. We've definitely got a shortage of podiatrists throughout the UK, there's no doubt about that, and in Northern Ireland in particular, and in the Republic of Ireland. But there's also a significant shortage in other countries in the world. So, for example, as I was saying at the start of this talk, I was talking about contacts that I have in Singapore, and I went out and worked in Singapore for a couple of years, so I've got some contacts there. And there's a high demand for podiatrists out there. So if you wanted to go out and work for a couple of years in Singapore as a podiatrist and earned a lot of tax-free money, then you would have that opportunity. So great opportunities abroad as well as in the UK. So you really couldn't be, I suppose, starting your podiatry degree at a better time because there's so many opportunities. It's fantastic. And of course, you can, if you're really keen, if you really enjoy the surgery modules in final year and you think, I would like to be a podiatric surgeon, you can go on and do that training. You'd have to do it over in England at the moment. It isn't quite set up here in Northern Ireland yet, though we believe and we hope that it will be soon, but it isn't at the minute. So you'd have to go over to England or Scotland or Wales and do some additional training if you wanted to become a podiatric surgeon. But the opportunity is there, and we have, as I say, we have a consultant podiatric surgeon who comes into us who trained at Ulster as a podiatrist and then went on and did the podiatric surgery training himself over in London. So great opportunities. You couldn't be coming into the profession at a better time, loads of work, and you can pretty much pick and choose the job or jobs that you want to do. So you couldn't be in a better place. Now this slide here, this is just the slide that you will see in the prospectus for podiatry, and it just gives you an overview of the course, some of the things that I've talked about, and the fact that we're accredited by the Royal College of Podiatry. It's now the Royal College of Podiatry. We got royal status last year. So you're accredited by the Royal College of Podiatry, and then you're registered with the Health and Care Professions Council in order to practice. So this is the course for you if you want to be a qualified practitioner. And of course, like all courses in universities, we are challenged all the time to look at what we're doing and how we're teaching and what we're delivering. And for that reason, we have to sometimes tweak modules and change them a little bit and add some information in and take some information out. And we change things around a little bit. And that's to try and make the course better and the modules better so that whenever you're coming onto the course, you get the best experience that you can. And we listen to student feedback as well. So we don't ignore our students. We have meetings with them every semester, and they tell us what's good and what's not so good and what could be improved, and we act on that and try to make it better for a better learning experience for the student. So you will find sometimes that these changes can take place a little bit at the last minute, and you just need to keep in touch with us to find out what's the final, what are we running with this semester for the final timetable and the modules. Things don't change massively now, I have to say. It's really just tweaking. So it's just to make you aware of that. So when it comes to entry requirements, there's always people have questions about the entry requirements. The entry requirements for our course are on the university website. But invariably, there's so many different qualifications out there that people have queries about, will this qualification still be okay to get on the course, and would it be considered? And I'm not really able to answer that because that's a very specific area. If you have any queries about the modules that you're doing or the course that you're taking, and you're not too sure if that's covered by the list that's on the university website, then contact admissions at ulster.ac.uk, and they will communicate with you, and you can tell them your query, and they will get back to you with an answer. So any inquiries about entry requirements, send them to admissions at ulster.ac.uk, and they will be able to sort that out for you. Okay, so I hope that that has given you a bit of a taster for podiatry and has whetted your appetite a bit. And I would look forward to seeing your applications coming in. You couldn't be joining a health profession at a better time. Podiatry is on the up. It's a developing profession. It's expanding its scope of practice, and it's the employment opportunities in it now are better than they have been since I've been in the profession, and I've been in it for 20 years. So couldn't be a better opportunity to join us. And I look forward to your applications. Thank you and goodbye.